Today I'm going to talk about the power of perspective and how by looking at the autonomic nervous system function in a different way, we can empower patients to believe that they can literally heal from pain. So this is an insight I got, and like an aha moment just a week or so ago. And it really became real this week when I was seeing my patients. And let's take an example. Patient comes in with low back pain, and on average, you know, you could say maybe 10% of their body area is in pain. You've got the low back, maybe upper, middle back. So 10%, that would be like 10 palm surfaces area over their back. So the reality is, they've got back pain, they're focused on back pain, they're complaining about back pain, they're trying to get better. The medical system has been looking at this 10% of their body area for pain, and their whole life is revolving around this. And we know from the work of John Sarno and also the MRI scan over the last few years, decade, that shows that the limbic system is in charge of the control center of pain, and the autonomic nervous system is literally firing off sympathetic pathways down to the area of pain, triggering tightness, lack of blood flow, and therefore a pain response. And this goes on and on and on and on, and the loop is never broken unless something changes within the brain or healing occurs. But let's flip it round. At the same time, the patient is not complaining of 90% of the body area that does not have pain. And what's happening in this part is there a balance between the parasympathetic and sympathetic, to the point where there's not enough tension to create that constriction of the fascia, and as a result, hypersensitivity of the nerves, and therefore the chronic pain response if it goes on for more than 3 months. So in this state, there's a balance between tension and relaxation. Tension and relaxation. And in essence, what their body is doing is maintaining a healing state for 90% of their body. And you think about that. The brain is controlling the autonomic nervous system for the majority of their body. The brain is demonstrating a healing response, a balanced response, a homeostatic response to its environment. Whereas in the 10%, it's out of balance. So the patient is literally living with a reality of healing 90% of the time, or 90% of the area. And I think patients need to be told this and reminded that they're actually not only a hero for suffering from pain, but they're a champion of pain themselves, because they've mastered a balanced nervous system. And all that needs to happen is the part of the brain that's controlling the low back needs to be influenced by the other areas of the brain that's mastered this. And we now know through epigenetics that that is very possible. In the world of neuroplastic brains, where we literally lay down new nerve signals and new nerve circuits all the time, if we remind ourselves that we literally are doing this anyway, we're a lot closer to overcoming this and even believing it's possible. Because we know, like from accidents, that when patients have, say, an accident and they've got low back pain, within 3 months, the inflammation is gone, or the acute injury and inflammatory response is gone. And people are left with this concept of being damaged and soreness, when really it's not true. The reality is the brain has been programmed for more pain, and the programming goes on with an imbalance of the sympathetic nervous system drive. So just thought I'd share that with you. It's really been a powerful message this week, and lots of people have liked it, and I just thought I had to share this yet again on one of these short videos. So I hope you like it, and I look forward to the next one for more tips on how to help and beat chronic pain. Thanks for now.